My name is Stefan Daniel, patient Dr. McCord. I've had quite a few back surgeries and neck surgeries, been through an awful lot. The results that I've gotten from him has been tremendous. He's kept me going. When I first came and met Dr. McCord, I was having real bad times, couldn't hardly move, couldn't hardly walk, with my lower back, middle of my back, my neck, I couldn't hardly mess around with it too much. He done lower back surgery on me and was very successful. And of course, we moved up to the T levels, and once again, very successful there. I have Parkinson's disease. After my first neck surgery, I was still having some problems, shaking real bad, and actually tore out the screws in my neck. Was shaking so bad at the time with Parkinson, and Dr. McCord worked on it, fixed it again. I've drive 7 hours, so with me driving 7 hours to see Dr. McCord, he's amazing to me. He's helped me quite a bit. I trust him awful lot with my condition. I've been through an awful lot. I've had 30-something plus surgeries, but I keep going. With him, it's just a special bond that I have with him. But I will start off saying this: if you do have surgery, he tells you to move, you get up and move. I've been through an awful lot. You get out of that operating room, you get up, go back to your room, you wake up, and you start moving. The more you move, the better you're going to be. I don't sit in a bed. If I could, I'd walk off the operating table. You have to listen to him. Exercise. That's when you start your healing process. So listen to him. If he tells you to walk, get up and walk. Oh no, I don't regret doing anything. No. Of course, I wouldn't want to go through it all again, but no, I don't have any regrets. I mean, it eliminated a lot of pain that I was going through. I mean, who wants to walk around with your, holding your head like this, No, you'd have to do something then. I wouldn't, I couldn't wait. The pain of what I was going through and the suffering, I mean, I can't help that I have Parkinson's and it shook the screws loose. To wait for a year to go by, that's unacceptable. I mean, it has to be fixed. And you have to rely on somebody with your expertise also to let me know that this, it's bad. Of course, I've seen it too on the film. To wait a year, no, it's very unacceptable.
So it was necessary we did that?
Yes, it was very necessary. With today, I can hold my head up, I can move it back and forth. I still have pain, but you're going to have pain to begin with. I don't see how an insurance company can tell you that it's not necessary. They're an insurance company. You're a doctor. I have faith in you. I pay insurance, so therefore, they shouldn't dictate to me. If something needs to be fixed, I can't get it fixed. I got to wait 3 months or 6 months. I'm the one going through the pain and agony. I tell them to go jump in the lake. I mean, seriously, because if the screws are out and they've come out, well, what is a year going to wait? What is a year going to do? The severity of my neck, with screws dangling in it and me moving it, could hit something and wind up paralyzed. That I don't buy that. Just because I have a condition that a lot of doctors don't even want to touch me because of my condition and for the stuff that I've been through. You know, a lot of surgeons after 30-something surgeries, not many doctors want to mess with you or even want to help you. Back when I started getting sick, basically several years ago, I was in a wheelchair for 2 years. I couldn't walk. I had to have help with everything. My hometown doctors told me to more or less go home and die. And I've got with my pain management doctor, I got with him, and he sent me to a hospital in Gainesville that was in Parkinson. 4 or 5 months later, I was out of a wheelchair walking again, where other doctors told me to go home and die, more or less, give up. And with the Parkinson, it's caused me to have a lot of back problems and necks, but you know, I keep going. For somebody to tell me that I need to wait, that's just unacceptable. Because if I'd have waited and done like they wanted me to at the beginning, I wouldn't be here. I'd be dead. He can't assess me without never meeting me, for one thing. If he's never looked at me or talked to me or tested me. To me, that doctor has got an ego problem. He doesn't care about his patients. Because if you care about your patients, like you do and treated me, you know, he has I think there's more of a personal problem than a professional problem. And in that category, you can't judge somebody without, you know, without looking at them. You just can't do it. I have all the faith in you. You've got me this far. You've kept me. I had a pain pump. I had morphine in me all the time. I had Dilaudid in me all the time. Since I've came and seen you, all that's gone. You've really helped me, and that's the reason I drive 7 hours, is to come and see you.
Stephen, thank you, because that's really what I'm about.
Yeah.
This right here.
Yeah. I mean, if it wasn't for that, you know, just give you an example. I live in Albany, Georgia. I drive 7 hours to Nashville to see you. I drive another 3.5 hours to Gainesville, Florida to see another doctor. Then I drive another 4 hours to go to Atlanta. Then my other surgeon is in Portland, Oregon. Luckily, I hadn't had to go see him recently. But I mean, you know, that's, to me, I want professional care. And the doctors that I go and see are professionals, and they care.